هنتكلم النهاردة على الفيرال سيكسوال ترانسميتد انفكشنز او الفيرال سيكسوال ترانسميتد ديزيزز. حضراتكم انا دكتور اشرف حسن، استاذ الاندرولوجي، استاذ الجلدية ورئيس اسم الجلدية. هنشوف النهاردة how to define viral sexual transmitted infections. هنشوف الاتيولوجيكال فاكتورز، الكومبلينت بتاع البيشنت نفسه، لما اعمل اكزامينيشن هيظهر لي ايه، هطلب له انفستيجيشنز من اللاب وهعالجه ازاي. لو اتكلمنا على الفيرال سيكسوال ترانسميتد انفكشنز، احنا هنختار اهم حاجه بالنسبه لنا اللي هي الاكوايرد اميون ديفيشنت سيندروم او الايدز، وده معروف طبعا ومنتشر في الفتره الاخرانيه. الجينيتال هيربس، الكوندايلوما اكيوميناتا، المولاسكم كونتاجيوزم، السيتوميجالو فيروس انفكشن، الهيباتيتس اي وبي وسي وانواعها المختلفه، ونبذه بسيطه عن حاجات تانية خفيفه كده. الاكوايرد اميون ديفيشنت سيندروم الاختصار بتاعه الايدز. لو حبينا نعرف الاكوايرد اميون ديفيشنت سيندروم، هو عباره عن عندي حاجات معينه لازم تبقى موجوده: proven HIV positive infections plus CD4 T lymphocytes count less than 200 per microliter plus one of the opportunistic infections or cancer, encephalopathy, recurrent bacterial or TB pneumonia or other condition indicating underlying immune deficiency. يبقى البارامترز ديت مهمة بالنسبة لي. حضراتكم لو تعرفوا الاوبورتونستيك انفكشن هو الانتهازي او الانفكشنز اللي بتستغل الموقف ده. لو بصينا على الفيروجي بتاع الاتش اي في، هو عبارة عن مجموعة لينتي فيروس، سب جروب اوف ريترو فيروسز او ريترو فيروسز، وهنقول للتسمية بتاعت الريترو فيروسز. في منه two types: HIV1 the most common in Europe and USA, and HIV2 most common in Africa with longer asymptomatic period and less perinatal transmission. The name retroviruses due to the presence of enzyme reverse transcriptase enzyme which has the capability القدرة to form DNA from the RNA of the virus. And this family of viruses known for latency, persistent viremia, infections of the nervous system associated with weak host immune response and high affinity for CD4 T lymphocytes and monocytes. You can see the distribution of the AIDS, the darker color, red color, the most common areas, and the lighter one, the less. Most of transmission may be sexual contact, heterosexual contact, or homosexual. Homosexual may be higher incidence due to aberration in the columnar epithelium of the rectum and the high incidence of sexual transmitted infection. Blood or blood product transfusion via transplanted tissue, intravenous drug use with shared needles, addiction, and also transmitted transplacental, which is known as vertical transmission, transplacental in utero or by perinatal infection or neonatal via breast milk. The virus may be found in all fluids: blood, lymphocyte, plasma, semen, tears, saliva, urine, milk, and cervical secretion. We can see the structure of the virus. It is a retrovirus family, RNA single strand. We can find the viral genome, RNA, and this is the reverse transcriptase which convert or make a copy from the RNA of the virus to DNA similar to the host cells. And this is the envelope with certain receptors formed of glycoprotein, such as glycoprotein 41 or glycoprotein 120, and also other types of protein. And this is the receptors that helps the viral particle to be attached to the host cell. The pathogenesis start by HIV binds to the CD4 T lymphocyte, then enter the cell, become internalized. After that, the virus replicates itself by generating a DNA copy by reverse transcriptase زي ما قلنا قبل كده. After formation of this DNA copy, viral DNA become incorporated, بيتداخل مع الهوست DNA cell, enabling further replication. The AIDS passes by 4 stages. Incubation period may be longer, 3 to 10 years. The first stage, which is known as acute viral infection, and this is also seroconversion. Incubation period 3 weeks to 6 months, may be no symptoms at all, or any of all the following: oral candidiasis, macropapillary rash, generalized lymphadenopathy, aseptic meningitis. Like in this stage, the titer of anti-HIV antibodies not appear before 2 to 3 months. So the diagnosis in this stage via rise indicators of the viral replication, which is protein HIV protein 24 antigen known as the viral core protein, and detected at this stage. Stage 2, early disease or completely asymptomatic. It lasts for more than 6 years in 65 to 85% of cases. During this period, high anti-HIV antibodies and cytokine tumor-causing factor. Stage 3, which is known as the intermediate phase or overt disease, and the severity is directly related to the decline of the CD4 T cells, the immunity, which cause diminished function by T cell, and also decrease the gamma globulin formed by beta cell, causing hypogamma globulinemia. Stage 4, which is the actual AIDS disease, and in this stage, severe opportunistic infection and uncommon malignancy, and this is the stage mostly of morbidity and mortality. لما يجي لي العيان اللي انا هشخصه، هاخد منه الهيستوري. start by the history for this patient. The history may be non-specific with fever, weight loss, night sweats. The eye may be blurring of vision or floaters. The ear dysphagia and thrush on the oral mucosa, or shortness of breath, dyspnea or exertion, and the cough, chest pain. Non-specific. May gastrointestinal manifestation, dysphagia and oral ulceration, diarrhea, abdominal pain or vomiting. The neurologic complaint may be headache, altered mental status and dementia, or with depression, suicidal ideation. Going to the examination of this patient on physical examination, the upper part, the head, the eye, the ear, nose, and throat, we can find oral candidiasis, oral hairy leukoplakia, and the retina with cottage cheese and ketchup appearance, like a piece of cheese and ketchup on it. Examination: the neck, persistent generalized adenopathy, and the meningismus like frequently absent in cryptococcal meningitis. Examination of the respiratory system may found pulmonary normal finding or consolidation changes. The most common pneumonia caused in this disease is pneumocystis carinii pneumonia, or other types of pneumonia due to Mycobacterium avium, TB, or cytomegalovirus. We can find extensive pulmonary Kaposi sarcoma, which is a sarcoma arising from the endothelium of the blood vessels, or lymphocytic interstitial pneumonitis due to Epstein-Barr virus. On abdominal examination, may be tenderness. These tenderness may be due to pancreatitis or biliary tract disease or hepatosplenomegaly on examination. Neurological finding: confusion, is dementia complex, focal deficit in the neurologic system, myelopathy, encephalitis, retinitis, meningitis, or any space occupying lesion due to infection or tumors. The dermatological finding is a typical presentation, non-specific, but presentation with an uncommon presentation. Maculopapular rash, seborrheic dermatitis like eosinophilic folliculitis, chronic disseminated herpes simplex and herpes zoster with uncommon presentation, bilateral, monilial infection, Kaposi sarcoma, molluscum contagiosum, bacillary angiomatosis, or drug rash, or non-specific such as psoriasis, ichthyosis, and Reiter syndrome. This is the Kaposi sarcoma. This is violaceous papules. This is Kaposi sarcoma on skin. And this is the oral thrush or oral candidiasis, whitish membranes, extensive on the mucous membrane. There are some syndromes associated with HIV, such as persistent generalized lymphadenopathy syndrome, or AIDS-related complex with these manifestations such as fever, fatigue, diarrhea, weight loss, night sweats, immunological abnormalities, or CNS disease with dementia and spontaneous neoplasms. The International Association of AIDS puts certain criteria to diagnose a patient of AIDS from the clinical findings, symptoms, and signs, then go to the laboratory investigation. For AIDS in adults, we must have or find two major criteria and at least one of the minor criteria. The major criteria: weight loss more than 10% of body weight, or chronic diarrhea more than 1 month, or prolonged fever more than 1 month. The minor criteria: cough more than 1 month, generalized pruritic dermatitis, recurrent herpes zoster, oropharyngeal candidiasis, disseminated chronic herpes simplex, and Kaposi sarcoma or cryptococcal meningitis. In children, it is different: 2 of the major and at least 2 of the minor. The major criteria: weight loss or slow growth, chronic diarrhea more than 1 month, prolonged fever more than 1 month. Or the minor criteria: generalized lymphadenopathy, oropharyngeal candidiasis, cough more than 1 month, generalized dermatitis, maternal HIV infection if the mother is infected, and repeated otitis or pharyngitis. 2 of the major and at least 2 of the minor. Then we expect this patient is AIDS. We ask for the lab finding. Some lab finding non-specific or associated with the infections and the tumors, such as the arterial blood gas in cases of pneumocystic carine pneumonia and oxygen saturation decreased. Complete blood count with granulocytopenia, drug-induced neutropenia, or anemia, and this is anemia may be due to blood loss or bone marrow infection due to mycobacterial infection. The electrolyte and L-creatinine may be disturbed due to diarrhea, dehydration, or due to vomiting. Also, we ask for the blood culture, and on blood culture we can find any of the mycobacterial, bacterial, or fungal, or viral finding, خاصة لو عندي fever without a source. Also ask for stool examination. We can find also opportunistic parasitic infestation and ova, Clostridium difficile, Cryptosporidium species, and acid-fast organisms. On going to the chest and CT, especially in cases of cough, dyspnea, fever without a source, night sweats, fever, or weight loss, we can find the most common pneumonia, pneumocystic carine pneumonia, with diffuse bilateral interstitial infiltrates or spontaneous pneumothorax. Or also we can find different types of TB, tuberculosis with upper lobe infiltration or cavitation, hilar adenopathy with pleural effusion, or the fourth miliary TB pattern. The brain and head examination, CT, especially in cases of headache or focal neurological deficits, also toxoplasmosis with multiple hypodense and ring enhancing lesions. Direct the patient and ask for the direct detection or indirect detection of HIV by the lab. The direct is HIV culture, and this is difficult and expensive. Culture of the host lymphocyte in presence of interleukin, or the HIV antigen test for protein 24 in the core of the virus for direct detection of HIV. Or ask for the indirect detection for detection of antibodies via two initial screening tests or confirmation tests. The initial screening tests include ELISA, latex agglutination, initial screening test, or the confirmation for detection of protein on the surface 24 and 31, or glycoprotein 120 and 160 via the Western blot analysis or the immunofluorescence. To prevent HIV infection, prevention of sexual transmission, the main source, prevention of non-sexual blood transfusion organ and addiction, prevention of vertical transmission. The vertical transmission prevention via during the antepartum or during pregnancy, we continuously detect CD4 cell count, the viral load in the mother, during tuberculin skin tests of herpes, toxoplasma, cytomegalovirus, and for hepatitis. And start combination of antiretroviral viral therapy as early as the 14th week of gestation to decrease the viral load of the mother and decrease the amount passing to the child. During labor, vaginal delivery not preferred to decrease the time of contact between the child and mother fluids, child body isolation immediately and washing, then also giving loading dose of therapy during delivery for the mother and for the infant till 6 weeks after delivery. The postpartum period prevent breast milk because the virus is present in the milk, and using contraception by hormonal method to decrease the incidence of pregnancy the following period. We take this time to decrease the viral load by treatment in the mother. The treatment goal aiming to maximal and durable suppression of viral load first, then restoration or at the same time or preservation of the immunologic function, improve the quality of life, and the reduction the morbidity and the mortality for these patients. When we start immediately anti-HIV drug, in case of primary HIV infection, in case of any symptomatic or AIDS-defining condition, when we find the CD4 count less than 350 cells per cubic millimeter, when we find the viral load by PCR, the viral RNA, more than 10,000 copies per milli, in case of pregnancy to prevent vertical transmission, and post-exposure prophylactic measures for the staff dealing with the patient. When I change the drug, in case of drug failure or drug interaction to this patient or toxicity, and we can change from monotherapy to multiple therapy when we can find no response of monotherapy. There are different classes of antiretroviral drugs. Two of them working on the reverse transcriptase enzyme as inhibitors, which is the nucleotide reverse transcriptase inhibitors and non-nucleotide reverse transcriptase inhibitors, or affecting the protein formation protease inhibitor, or affecting the fusion of the viral particle to the host cell via fusion inhibitors. These are the classes of antiretroviral drugs. In addition to treatment of the result of opportunistic infection and malignancy, and passive immunization of this patient by immunomodulators to restore T cell function, such as interferon, interleukin 2, and isoprenosin. There are future vaccines expected, subunit vaccine by recombinant DNA technology and liver recombinant microorganism. The second and the most important infection in civilized countries now is the genital herpes. As you know, genital herpes, two types, type 1 and type 2. Type 1 most common around the mouth, and type 2 most common in the genital area. The etiology of this disease is herpes simplex virus. Type 2 mainly, as we said, and type 1 in some cases, especially with oral sex. It is a family, herpes viridae family, double-stranded DNA differ from the virus causing AIDS. The same structure as a virus, with the core with the DNA center, the capsid, the envelope, and the glycoproteins on the surface of this envelope. The problem of this disease is the recurrence. Some say that it is not treatable and also causing cancer cervix in the female. So this is the most important point. The transmission of this disease via sexual contact or contact with genital secretions. The virus from the mucocutaneous surface attach or enter into the sensory nerve terminus via special virus receptors on these terminals. Then this virus penetrates the nerve axon to reach the nerve ganglia and stay there, and this is the problem for recurrence. Also, contamination via contaminated foaments and towels. The incubation period in this disease or infection very short, not like AIDS. It is 2 to 7 days, may be asymptomatic or symptomatic, may be primary or recurrent herpes simplex, and this is grouped vesicle as clinical picture. Grouped vesicles on erythematous base، مجموعة من الحويصلات الصغيرة على قاعدة من الحمرة. The complication is the most important. With secondary infection may cause dysuria or urine retention. Urine retention, this may be due to pain associated dysuria or radiculitis. In homosexual, affection of the rectum, tenesmus, and constipation. Also, we can find necrotizing cervicitis, cancer cervix in the female, and if during pregnancy may cause abortion, fetal death, congenital anomalies, and neonatal herpes. May be associated with keratoconjunctivitis, herpetic whitlow, meningitis, كابوسي فيروسيفورم eruption، ودي الحاجات برضو هتلاقوها في الجلد مع التايب 1 herpes simplex on the oral mucosa. The lab diagnosis, the culture also difficult, tissue culture on HeLa cell or monkey cell, or non-culture technique with scraping of the lesion and zinc smear to see large bizarre epidermal multinucleated giant cell with ballooning degeneration as any viral infection and internuclear inclusion جوه الخلية نفسها، جوه النواة نفسها. Or PCR detection, direct immunofluorescence, electron microscopic examination, and serological screening test for asymptomatic carriers. The treatment: avoid transmission, accept the recurrence by speaking to the patients, or yearly cervical cytology for early detection of cancer cervix. And the specific treatment to 2 drugs: acyclovir, the first appearing, and valcyclovir. Cyclovir working via selective activation, accumulation, inhibition, and obligate chain termination of the viral particle. The dose 200 milligram 5 times per day for 5 days in cases of acute, or 400 milligram twice daily for 6 months in cases of recurrence, or valcyclovir 100 milligram per day for 5 days. Symptomatic treatment: treatment of complication in neonatal, in neurological, and secondary infection. This is the second disease or secondary most important viral sexually transmitted infection. The third one is condyloma acuminata. Condyloma acuminata, as we studied in dermatology, it is a type of wart of sexual warts, condyloma acuminata, and this is caused by human papilloma virus. There are many, more than 75 genotypes, and more than 20 of them cause urogenital lesions. Characterized by papillomatous growth in the urogenital or perianal or perinatal perianal skin or perineal skin. The danger of this infection, some strains are highly risk for malignancy or oncogenic potential, such as serotype 16 and 18. Other types with different type of oncogenic potential, intermediate or low risk. The human papilloma virus, it is the Papoviridae family, DNA also double strand. A human papilloma virus can be transmitted sexually via semen, and type 16 and 18 DNA is present in sperm cells and may be transmitted to the partner as a sexual transmitted infection through the sperm. A clinical picture appearing as skin colored, the same color of skin or slightly pink or white verrucous papule, verrucous surface like any type of wart that may be solitary, small, or increasing in size and becomes confluent, forming a cauliflower mass. Bleeding may be associated or urethral discharge in urethral affection, in homosexual affecting the anus or rectum or around the opening of the anus. In cases of subclinical cervical affection not diagnosed without colposcopy, may be large confluent mass leading to obstruction or obstructed labor or laryngeal papilloma in infant during vaginal delivery. The main differential diagnosis is condyloma lata, and the complications are malignancy. We diagnose it easy by skin examination when it is present on the surface of the skin around the genitalia or anal or perianal region. The difficult diagnosis is abnormal presentation or internal presentation, and inside the urethra by urethoscopy, anoscopy in the rectum, or colposcopy. Subclinical tests with acetic acid test, 5% appearing as white areas. Periodic follow-up, early diagnosis of potential malignant changes, and also examination of the partner. The treatment, like the virus, but we can use some cytotoxic drug, such as podophyllene 20% in tincture benzoyne, and the application by the doctor itself, not by the patient. Trichloroacetic acid 50% or 5-fluorouracil 5% cream. We can use also interferon intralesional injection 3 times per week by interferon alpha 2b or using immune stimulation. This is a chemical treatment or physical treatment via cryocauterization, especially in pregnancy, electrodesiccation, laser, or surgical removal of large mass, and cauterization of the piece. As a rapid view of some other important viral sexual transmitted infection is cytomegalovirus. Cytomegalovirus is herpes viroides family, DNA double strand also, and this is the structure of the viral particle. The importance of this infection is that it is spread by intimate contact with the infected body fluids, including semen. So, the semen contain viral particle. The second point is it survives in the frozen and thawed semen used for assisted reproduction in the centers for assisted reproduction. And it is a possible causative agent for hematospermia or appearing blood in the semen. Cytomegalovirus is responsible for more prenatal and perinatal viral infection. And it is the most important factor for congenital infection and damage. It increases the risk of AIDS, possibly by activating CD4 T lymphocytes such as HIV-1 esposes. Other types of viruses like hepatitis B and C and E may be also transmitted sexually. However, hepatitis C suspicious. It is a flaviviroides family. Sexual transmission of hepatitis C can be ruled out. However, it may be absent after protocol selection during the assisted reproduction. We hope to separate the HCV viral particle and decrease its frequency. Maternal transmission may be also a factor. These are some questions, multiple choice. Try to select the most important answer as an example for this question on this subject. And thank you.